Hello and welcome. I am Stephen and this is Glo Road City Hospital. This is day 2 of our Women's Health Day, and yesterday we had very beautiful sessions with women. We came for screening of the cancer of cervix, breast cancer screening, Hpv screening, and lots more. And they've been having beautiful consultation sessions. Now today is our consultation with a reproductive health specialist. Now, we have invited a consultant and expert in this field to give us a talk on why women should have this cancer of the cervix screening, breast cancer screening, and a lot of screenings that's supposed to help women from different age brackets. Now sit back and enjoy.
Okay, you're welcome. Good day, everybody. My name is Dr. Oyetunde. I'm the medical director of Glo Road City Hospital. And with me here is Dr. Titilope Eromosele. She's a consultant, public health physician, and reproductive health specialist. She's here today to educate us on cancer of the cervix. How can you know? How can you prevent it? And she wants to talk about breast cancer too. How can you detect? Because we know that early detection can guarantee 100% cure from these cancers. So it doesn't have to kill you. So how can you know early if you have anything like this? What symptoms can you see? So I will introduce Dr. Titilope Eromosele to us. Please introduce yourself.
Thank you so much. Once again, she has done the prior introduction. I will say again, my name is Dr. Titilope Eromosele, consultant public health physician and reproductive health specialist. I'm so glad to be on here in Glo Road City Hospital, and it's a Women's Health Day, and we're actually running an outreach right now, which started yesterday and is going to end tomorrow. So it's a great privilege to be here and to talk on these cancers of the cervix and of the breast that affect women. So first of all, I want us to start with cancer of the cervix. And cancer of the cervix is the second commonest cancer in women, and it's really very common, especially in sub-Saharan Africa. And we want to know what are the things that cause cancer of the cervix. Now, the Hpv infection, human papilloma virus infection, has been incriminated to be a cause of cancer of the cervix, because many people that develop cancer of the cervix, when the tests are done to assay for HPVs, most of the time HPV virus strain is detected. So HPV virus infection can be the cause, and this can be caused by having multiple sexual partners. So somebody that has multiple sexual partner has a high risk of developing cancer of the cervix. Also, highly sexual debut. Somebody that marries at a very early age, like maybe from 9, 10, 11, 12 to less than 18, has a high risk for cancer of the cervix. Also, multiple parity. Multiple parity, I'll break it down in simpler terms as bearing more than 5 children. So, such women to have also a high risk of developing cancer of the cervix. Also, we have history of smoking. Smoking also gives a woman high risk of developing cancer of the cervix. Also, alcohol too, although that has not been totally, the evidence is not so sure, but alcohol too has also been incriminated to may have to lead to cancer of the cervix. So cancer of the cervix, it's actually a dangerous cancer because many women don't detect it early, and if screening is not done and there's no early detection, it will lead to complications. So what are the signs and symptoms? We want to talk of the signs and symptoms. Basically, it usually comes with bleeding per vagina, bleeding through the vagina. We see women just bleeding through the vagina, bleeding in between their periods, bleeding after sex, and those are signs of having cancer of the cervix. Also, there could also be foul smelling vaginal discharge. That would also be a sign of cancer of the cervix. So the complications, there are a lot of complications that can arise from it, just like having cancer, metastasis to other parts of the body, and also different complications, organ failure, and some other complications can occur, and death can also result in death. So these are the complications that can come from cancer of the cervix. So now, how do we treat cancer of the cervix? Basically, for us, with most cancers, if there's early detection, there could be cryotherapy. Cryotherapy can be done, and if there's early detection, convulse will be done, and cryotherapy will be done. Also, if for people that have developed later stages of the cancer of the cervix, they can go through surgery. They can go through surgery, they can go through radiotherapy, and they can go through chemotherapy. And for prevention, because we are out there to prevent, prevention is actually better than cure. And we said that if detected early, it can even achieve 100% cure. So what the preventive strategies that we can use for cancer of the cervix is to, one, do screening, cancer screening, which we are even doing through this program, and we do VIA, visual inspection with acetic acid. We can also do VIL, visual inspection with leukocytosis. And so we do the test and we screen to see if it is positive. The woman will be taken for further evaluation and management. And if it is negative, the woman is free and can come for a repeat test 3 years after. So also, we can also do HPV screening. HPV screening is human papilloma virus screening. That's to detect if there is a strain of human papilloma virus in a woman. And so that can also be done. And if it's found, if HPV test is positive, can help us to know if there is pre-cancer development. So we'll be able to know the necessary actions to take. And also, apart from that, we can also prevent cancer of the cervix by vaccination, by giving human papilloma virus vaccine, and it's usually best given among young people from age 9 to 26, basically, and more for between age 9 to say 13, 14 thereabouts in teenagers, because at that stage it helps to, when they are not, especially when they are not sexually active yet, it's very, very effective at that stage. Also can be given to age 26 in women, and in men from 9 to 21 years, they can take the Hpv vaccine. And so through that we can prevent cancer of the cervix. And generally, as we usually counsel for any cancer prevention, we counsel that people are on good diets with fruits and vegetables. They don't take anything that can predispose them to developing cancer. So I want my colleague here, I know she has some things to add to what I said. So,
thank you very much, Dr. Mowe-lbafo. We really appreciate you.
Yeah,
we appreciate you for educating us on risk factors for cancer of the cervix. Yes, she has educated us that early marriage or even early exposure to sexual intercourse, whether in marriage or out of marriage, the earlier you're exposed to having sex, the higher your risk for developing cancer of the cervix. And then among all things, I think all we are advocating for is early detection. You can get 100% cure from cancer of the cervix. And we said, again, just to reinforce what our consultant has talked about, the Hpv vaccine, the earlier you take it, the more effective it is. But we still note that even in our adult age, can't you take again, we that are more than 26 years old?
Yeah, people do take it, but we know that effectiveness is higher when taken at an early age. So people take it.
The teaching, they said, okay, when you take it earlier, you get to take 2 vaccines, but when you take it 2 doses of the vaccine, but when you take it later, you get to take 3 doses of the vaccine. You take the first one. The second one is a month to 2 after the first dose, and the third dose is like 6 months after the first dose, so that it will still have some protection.
Yeah.
Now, not to say.
Yeah.
Thank you very much.
Thank you.